challenge that we all face dealing with this area of cardiac disease in pregnancy. And now we call it cardiobstetrics. So last week was a publication in the journal Circulation, which is the most reliable scientific journal in cardiology, describing the incidence of cardiac problems during pregnancy. About 60,000 deliveries, showing that 4% of these women have some kind of cardiac problems. And this has been a significant increase over the last 20 years. And the reason for that is that the population of women who become pregnant is changing. The age is increasing, so women tend to become pregnant now in older age. Because of that, we have more comorbidities. So we see more high blood pressure, we see more diabetes, and we see more obesity, which has been a major problem and a risk factor. In addition, we have a population of women with congenital heart disease that now, because of the successful surgery at young age, survive to the childbearing age. So we have a larger number of women with congenital heart disease who want to become pregnant. The valvular disease, which has been less common in countries like the United States or Northern America or Europe, still a major problem in Asia, India, because of rheumatic disease. So we now face a situation in which we see more patients. Challenge, in addition to the fact that we have more patients, is that the spectrum of disease during pregnancy is very broad, very broad. So a physician who is trying to get into this field facing a challenge, and the challenge is to really accumulate enough experience and expertise in order to be able to do an effective job. So this is the challenge, and we can talk about how how are we going to face the challenge and what progress have we made over the last 15 years. Physicians from all over the world have created opportunities to learn. We have, in the upcoming meeting, we have over 60 invited speakers. And really, I don't have the exact number, but we have many invited lectures. In addition, we're going to see probably something like 200 abstracts. And the abstracts represent work which is being done by physicians from all over the world. And so it's really an opportunity to be exposed. And we also have many complicated cases and discussion. So it is an opportunity to be exposed to a lot of information related to cardiobstetric. And again, for the people who are entering the field now, this is an opportunity that should not be missed. Again, giving you in 2.5 days really a wealth of information that's very difficult to acquire on an individual basis in your hospital. The challenge is that it takes some time to get comfortable with this situation. This is a complicated situation where we have two patients. We have the mother and we have the fetus. And so that everything that we do, we have to take into consideration the changes in pregnancy. I'm talking about the physiological changes, the hemodynamic changes. And this is unique to every condition. So as I say, any opportunity that a young individual, somebody who actually getting into this field, every opportunity that they have to acquire more knowledge by attending lectures, reading the literature, reading the books that are basically devoted to this field, attending a meeting like our meeting, but any other meeting, any opportunity to learn. And the other thing is that don't be ashamed or shy to call or write to somebody who has more experience. So this interaction between physician with more experience is extremely important. I'm inviting anybody who is interested in heart disease in pregnancy to come to Barcelona. We have created so far a family of people from all over the world, created friendship, created collaboration, really have a lot of the people who are now becoming really important in the field have started their career in the CPP. So this is a great opportunity and a combination of a beautiful city and great meeting. Don't miss it.